Thank you, Namu. Hello, everyone, and welcome to Medicine for Members. It's my pleasure to host the Medicine for Members session this evening. And we're here to find out about the Cambridge Global Health Partnership. The title of the session tonight is The Power of Partnerships. And we're going to find out about how we've 15 years of global health partnership activity here at CUH between our hospitals and other hospitals in low and middle income countries. And we're going to hear tonight about how health partnerships can improve healthcare globally. And I, for one, am very interested in this, given the pandemic situation where the power of partnering with countries to solve healthcare problems has never been more relevant to all of us. So this evening, I want to just thank members for joining this evening. We have members who are on Zoom, and could I ask you if you have any questions to put your questions in the Q&A box during the session. We've also got attendees who are joining us via the staff Facebook group. And could I ask you that are on Facebook, could you please insert your questions in the Facebook comment box, and we'll pick those up as we go along. So we're going to have some presentations from our panelists, and I'll introduce our panelists to you shortly. If we don't get through all the questions this evening, we will get back to you after the event, because we've got all your email addresses, so hopefully we'll manage that. If we don't, we'll try and pick those up afterwards. So it's my pleasure to introduce our speakers to you this evening. We have Evelyn Briley, who is Director of Cambridge Global Health Partnerships, and she joined the Global Health Partnership in 2008. And between 2011 and 2015, Evelyn was based in the Ministry of Health and Wellness in Botswana, leading the Botswana Cambridge Health Partnerships. Evelyn is an experienced international development professional with more than 25 years experience in the UK, East and Southern Africa. She's also worked in Central Asia and Eastern Europe. And her focus has been on the development of health, children's and social services. So welcome, Evelyn. We've also expecting Chris Moody, who's a clinical nurse specialist at CUH, and Chris is having technical issues at the moment, so I can't see her, but she's hopefully going to join us shortly. I'll introduce her nevertheless. Chris is a clinical nurse specialist, and she's been working at CUH since 1995. And she began volunteering for the Kampala Cambridge Health Partnership team in 2019. So hopefully she'll join us and tell us more about that. Laura Hobbs is a specialist anaesthetics trainee at CUH, and she was a first-year intern at CUH in 2013 to 2014. And in 2018, 2020, she worked as an anaesthetic registrar, and she's also got 6 months of specialist training remaining to do in Norwich. Laura is soon to be starting a PhD, and the title will be Systems Approach to the Intelligent Design of Trauma Systems in Fragile States. Laura is an East of England Global Health Fellow, and she's working with the Kampala Cambridge Health Partnership and with the University of Cambridge, and also with the World Health Organization Trauma Operational and Advisory Team Joint Project. So I hope she'll tell us all about that this evening. So first up, we're going to hear a presentation from Evelyn, followed by a short video, and then we're going to field some questions to our other speakers, Evelyn and Chris. And I could just see Chris has joined us. Welcome, Chris. We can't see you, but I'm hoping you can hear us and that we'll be able to hear you. So over to you, Evelyn. If you could start things off for us, that would be great.
Great, thank you. Hello, everybody. It's great to have this opportunity. And So I'm going to tell you a little bit about Cambridge Global Health Partnerships and more broadly, and about a bit about our history. And I have a short presentation, and then I'll hand over to Adele, who will ask some questions of Chris and Laura. And Chris and Laura are the people who are most important to Cambridge Global Health Partnerships, because if it wasn't for staff of CUH who primarily volunteer their time and expertise, we wouldn't be able to do what we do. But we know that in doing it, they learn and gain so much that they also bring back into the NHS and bring back to CUH. So I'm going to share my screen, and hopefully it will all work. So there we go. So yeah, so as Adele said, is that all right? So as Adele said, I'm going to talk about the power of partnerships, but if I just tell you a little bit about Cambridge Global Health Partnerships. So we exist to work in partnership to inspire and enable people to improve healthcare globally. And our whole program is designed to enable that partnership and those individuals who are involved and benefiting from our partnership, that it's done safely, effectively, and ethically. A lot of it is done with exchange visits both way, but also during and since the pandemic, or for some, obviously the pandemic has not ended, but a lot of activity takes place through mediums like Zoom that we're using tonight, which is fantastic because it has meant more people are able to be involved and we're in more regular contact. So just a little bit of history. Some of you may have known about us for some time. We were established in 2007 by Dame Mary Archer, who was then chair of CUH, and Malcolm Kerr-Muir, who was in the back of that photo, who was an ophthalmologist in CUH. And they founded a separate charity, Addenbrooke's Abroad, very much in response to staff wanting to do more and recognition that staff were already doing more in global health, but also across the NHS, a recognition that people were involved in this and that it needed more recognition, but it also needed more support. And then in 2009, we became a linked charity of Addenbrooke's Charitable Trust. And in 2017, we changed our name to Cambridge Global Health Partnerships. So that photo was taken in 2007. Our first health partnership was with Botswana. And so a team from Botswana came to Addenbrooke's. And that was one of the first activities under then Addenbrooke's Abroad. And I'm pleased to say we still have some work with Botswana, and that's one of the partnerships I'll tell you a little bit about. So important to say that the UN Sustainable Development Goals have sort of changed the way that we do work. It is about equitable partnerships, and we work very much to achieve the Sustainable Development Goal number 3, which is good health, but actually a lot of those goals are relevant, and particularly number 17, partnerships for the goals. We have quite a wide footprint because, as well as our established partnerships, we support staff who might be going elsewhere. So the blue countries on that map are countries where we have supported staff from Cambridge and students to go and do some work. In 2017, we did a social return on investment analysis on our partnership with El Salvador. And that graphic at the bottom just shows what happens in terms of our volunteers, who we call our members, go and do some work, and then it has this amazing ripple effect, which has a real value. So in total, the value we found from the El Salvador partnership was a 1 to 3, but actually for El Salvador, it was 1 to 10. And for the NHS, it was 1 to 7. And at the moment, we're doing another social return on investment analysis, which we look forward to publishing later this year, about our Kampala Cambridge maternal health partnership. So important to say that, like I said, that it is beyond Cambridge. Cambridge is one of few NHS institutions that has a dedicated programme like ours supporting this activity. But there's over 200 health partnerships across the NHS, and it is informed by a lot of policy work that has been done and guidance, and we have also informed a lot of that. And there's a nice quote there from Ian Cumming, who was Chief Executive of Health Education England, recognising the benefits of these partnerships. And I particularly like what it says at the bottom, that the vision is that these placements will be the norm for healthcare staff and managers. And that's certainly what we're working towards. And we've made really quite some good progress over the last 15 years at CUH. So we talk about the win-win-win of the partnerships. We know that for the professionals involved, that they come back with extraordinary new skills. They have an opportunity to develop amazing skills, particularly when, well, the visits can be particularly important moments for them to develop those skills. But all of the work, including that we do in remote means, helps develop a number of skills. And we've done a lot of research, and there's been a lot of more broader research that has shown how professionals develop this kind of skills through the work that they do. Then for the partner institutions, a lot of training and capacity building, exposure to new practice, for example, and then a lot of professional development and long-term mentoring relationships that develop between the partners. And then, as I said, the importance of it coming back into the NHS and the UK health service providers. We know that staff come to CUH because they know that they can do global health. We know that some staff have stayed at CUH because they continue to be involved in this type of work, and across a number of other areas that are all listed there. So our strategy that we came out just before the pandemic kicked off in early 2020, but still is very relevant. So round the edge you see in the grey circle, the sort of very broad number of groups of people that are involved in our work, both on the Cambridge side and with our overseas partners. In the green, what we seek to deliver is a common resource for people in Cambridge who are interested in global health, to establish resilient networks and to deliver safe and effective and ethical health partnerships. And we know that through that activity, we're enabling learning and improvement. There's fantastic collaborative research that takes place, and multidisciplinary training and capacity strengthening. And as we're moving forward, our aim is to achieve a breadth of countries where we have partnership activity, a breadth of clinical areas, and that breadth of stakeholders, because we know that health is affected in so many ways by so many areas. And so it's really important to work in a multidisciplinary clinical team, but also in a multidisciplinary team more broadly. That we need to focus on the impact that our activity is having on our partners, on patients, and on the people involved. And that the importance of rigor in the design, delivery, and evaluation of our program. So just to tell you sort of the detail of health partnerships. So health partnerships, as it says there, are a model for improving health and health services based on ideas of co-development between actors and institutions from different countries. They're long-term, but they're not permanent. And they've been shown to be an effective way of improving health services through that reciprocal exchange. And we know that they inspire and equip and support healthcare professionals to make a difference and to develop new relationships, skills, and capabilities. And we know that kind of at the crux of health partnerships are important relationships between healthcare professionals. So there's some nice images there at the bottom of some staff from CUH, and those are actually all taken in our partnership in Botswana. One where a team from Botswana visited us, so that's them in the pharmacy in CUH, and then the one on the other side, on the right of the screen, is taken in Kampala. So, I mean, like I said, it has been quite broad. We've supported volunteers who've been active in more than 60 countries since 2008, and kind of slightly back of the envelope because it's difficult to quantify exactly, but we think that the value of expertise that has been volunteered through CGHP is more than £4 million worth. We've got established health partnerships now with those countries and across a range of clinical areas. So just as I said, I thought I'd tell you a little bit about one particular partnership. So the Botswana-Cambridge Vision 2020 link is a eye health partnership that was established in 2007 and has been funded through Seeing is Believing, which is a Standard Chartered Bank funding, as well as Combat Blindness International, who are an American organization. And we've worked across clinical services, done some research, co-research, and delivered some education. So we've worked with the government of Botswana to establish the only nationwide diabetic retinopathy screening service in sub-Saharan Africa. We've established a nationwide children's eye health service and a vision centre providing optometry services and spectacles to low-income groups. So that image at the bottom of the girl smiling is a girl who had never been able to afford glasses because she couldn't afford to go to private sector optometrists, and she came to the Vision Centre actually just before she was due to take her end of school exams, and was able to get a pair of glasses so she could see much better. And we worked with them and actually that was led by Malcolm Kerr-Muir, quite a novel approach where we partnered with a hospital in India and then with Botswana and Cambridge, and the team from India came to Botswana over a period of years to really help Botswana deal with the cataract backlog, but also help Botswana improve their service for cataract surgery so that they were able to increase the number of cataracts that they were doing. The research, we did a rapid assessment of avoidable blindness across the whole of Botswana to really help the government of Botswana understand the burden of disease, and then to be able to plan effectively how to provide services for people who are blind and with low vision. And then a number of medical students have worked within that partnership on various areas. And then we've done quite some continuing professional development for ophthalmic nurses and optometrists, and worked to strengthen ophthalmic nurse training with the International Agency for the Prevention of Blindness in Africa. And what was really nice is a number of years ago now was the IAPB annual, I think it's annual or every second year conference, and it was held in Durban. So it was quite close by. So we were able to go with a large team of from Botswana to both present the activity that we're doing in Botswana so that others could learn from our experiences, but also obviously to learn a huge amount back. And there's a ophthalmic nurse there who was trained and working with that child around checking children's vision. And then the other photo is a trainee who went out and did some research. So just to finally say, if you were a small team, so that's me and the members of the small Cambridge Global Health Partnerships teams that support all of this work. If you want to find out more and indeed to support us, because we are a charitable program, there's our website, and I will put the link in the chat. If you're on social media, we're on social media. And if you want to contact one of us directly, Hannah, who is in the blue flowery, not the blue flowery dress, the dark flowery dress, there's her email address. So please be in touch with Hannah. So I now wanted to move us more to our Uganda partnership. So I'm going to stop sharing this screen, and I'm just going to play you a video that was made, and this was made by the CUH comms team. So in 2019, the then head of communications at CUH joined a team of volunteers, and Chris was one of those volunteers that went to Kampala and delivered some training. So Ali went with them, did some filming, and then worked with her team to make this film. So I'm going to share my screen again. And, oh, sorry, hang on a sec. Oh, no, where is it? Sorry, here we are. And I'm going to press play. Is that all right?
Infectious causes cause about 20% of maternal mortality in our hospital. So that is an area where we need to understand which are the organisms that are causing these infections, which antibiotics can we use to prevent these infections, which other practices in the hospital like hand washing, decongesting the hospitals can we implement to improve or reduce the burden of infectious morbidity among mothers.
One small action of putting pen to paper and deciding to choose an antibiotic which is not really necessary for your patient can have very devastating effects later on in the short term, medium, and even in the long term. And so I really believe this partnership needs to be taken to another level, and we really need to include as many health workers on this as we can.
I think really it's about sort of learning from each other and really getting ideas together. To be honest, actually it's really exceeded my expectations. I was very concerned coming out here that particularly our quite interactive teaching style might not work so well. I just thought I might be met by a lot of blank faces when I asked people to join in interactive activities, but actually it's been the complete opposite. They've been so engaged and actually a lot better than some of the groups I've taught in the UK.
I think the interactive learning was very funny and entertaining for everyone involved, both the teachers and the people being trained.
The level of motivation of the participants was really high, and even the presenters, the level of motivation was high. No one, I mean, of course, there are some people didn't take enough coffee, but still, there were very few sleeping, so it was really fun to see them that attentive and involved. Initially, it was a call where Jamie and Musa didn't know each other.
Yeah, exactly. Yeah.
So we got to know each other more.
Yes.
And now we have got the training. I think we're on course to achieve even more brand objectives.
Absolutely.
For the outcomes of this global collaboration.
I certainly came back from my last visit and I just felt a bit more calm, collected, and just able to think, right, okay, yeah, there's a crisis going on, but we can deal with this. It's not as bad as you think. Culturally, everything, you know, going to another hospital, getting that input, seeing people in a different environment, and you know, seeing, even if you do a little thing, that will help. Oh my God, 10 out of 10. Yeah, definitely. Sorry, I'm getting it too.
What kind of drives me is the fact that I see small steps of success as I go along, and I've been encouraged a lot by colleagues here and also partners like actually in Cambridge, because sometimes when you're in the midst of all this you feel like giving up, but when other people say that actually things are happening, you keep going. It's been helpful to know that Cambridge is that kind of partner who views us as an equal partner, and of course we always emphasize that it's a win-win for whoever is involved, and it has been helpful, and I really want that to be the spirit in which we continue.
Just learning so much about the way in which people are able to manage such a vast number of patients under such difficult circumstances. And I know that there are, you know, places which are much worse off than some of the places that we've seen and we're helping. But that people are very resourceful, that they're incredibly proud and upbeat of their work. And people are very open to learning. And I'm not convinced we are always very open to learning.
I feel I have to fulfill something which is not yet being fulfilled, to make sure that the Ugandan woman, they get the quality care they deserve at the time of childbirth. So I think when that is achieved, maybe I'll think of other things, but for now that keeps me really working towards that goal.
There we go. Sorry, I didn't quite stop it in time, but thank you. Hope you enjoyed that video.
Thank you very much, Evelyn. That was amazing. Very powerful stories and accounts there. So yeah, well done on getting something like that together and sharing it with us. So I'm pleased to see that we've got Chris now with us, Chris Moody. Hello, Chris. Hope you are hearing us. That's great. Hi. Right. So let's just sort of try and get a little bit more questions going around this. And I'd like to just sort of bring Chris and Laura into this now. So maybe start with you, Chris. Hopefully you can tell us a little bit about about your own involvement in the Global Health Partnerships activity. We saw you on the video there, so tell us a little bit about that.
Thank you, Adele. So I joined at the end of 2018 with Dr. Whitehorn, who was our reasonably new microbiology consultant to COH, and we've been talking about healthcare in terms of NICU babies and SCABU, and he said that he had this exciting project that he was part of, and would I like to be involved? And I said, oh God, yes please. Of course. And you know, having been the divisional infection control nurse for a number of years now, it was lovely to sort of take on board what I had learned as an infection control nurse for that division, and take that into in going to COEMPE, and sort of looking at the different side of infection control in that particular area. I think it's interesting to note that I think I was the only infection control nurse that went anywhere that year, and most of the other partnerships, is my understanding that infection control weren't involved. And actually, even though the premise was about antibiotic stewardship, very much infection control goes hand in hand with that, and that's something that we try and do in COH as it is. You know, we have infection control involved in antibiotics and the care of patients. So for me, it was really sort of an extension of what I had been doing for the last, let's think, how long have I been in infection control now? 17 years. So, you know, for me, it was really great to sort of take some of my, what I would consider my more day-to-day information and patients and all those sorts of things, and take it and look at a different culture, look at how they have to deal and the challenges that they deal with on a day-to-day basis, which are completely different from what we have to deal with.
Yeah. And was that challenging for you, Chris? How did you find that personally?
I found that really, you never know what to expect, do you? And you go with a very open mind. But yes, sort of the reality of women giving birth, and the fact that, you know, they might have a bed to give birth on, and then the next minute they move down onto the floor, all those sorts of things are things that, you know, we do take it for granted in this country, and sort of, you know, so I'm looking at it, yes, very much from an infection control perspective, but, you know, it's all about the humanitarian side of that, and being human and trying to support people, isn't it, and make their birthing experience as good as it possibly can be.
Yeah. And what do you think you brought back from that to your work back home here?
So for me, it's really, I mean, I always thought I'd networked well, but it has really made that premise a lot easier to deal with. And I think you're so used to standing up and talking about your own subject to people who might not know as much as you, or need a bit of support. But it's really given me the confidence to link in with people who might challenge me a bit more. So, you know, it certainly has helped in my role that I've done for the last 2 years within the infection control team. It's given me that confidence to talk to people that I maybe not have spoken to previously, and be very mindful that the advice I'm giving them is the correct advice.
Thank you. Thanks, Chris. Laura, I'd like to bring you into the discussion. Can you tell us a bit about your involvement in the health partnership work, what you've been doing?
Yeah, so I first, when I was a registrar in Cambridge back in sort of 2019, got interested in global health and started talking to people who were working with CGHP. And I was actually due to go out to Myanmar as part of the Myanmar partnership in February 2020. And COVID happened, and unfortunately, a few days before we were due to go out, we had to cancel the trip. And obviously that was really devastating, but actually really highlighted that global health is everybody's problem. So obviously going into the pandemic, I kept in touch. Obviously the Myanmar partnerships had its own challenges with what's going on in the country as well as COVID. And so some of that work has had to be put aside, but I sort of kept my involvement. And when the East of England, Health Education England Global Health Fellowships were advertised, I jumped at the chance to apply because I knew it would give me the opportunity to have some time, so funded time for me to spend on global health work. So I was really fortunate to join the first batch of global health fellows. I think there were 8 of us, Evelyn can correct me if that's right, from a wide range of specialties. So I'm anaesthetics, there's obs and gynae, public health, infectious diseases, and we've all been working on different projects. Mine's been a sort of multi-layered project, so I've done some work with WHO as part of their trauma advisory team. I've been working primarily with CGHP, looking at the Scale Uganda partnership, so looking at the development of the workforce of critical care doctors in Uganda, and that's been amazing. We've just come back from a trip to Kampala, which was incredible, and we actually went with the antimicrobial stewardship team at the same time, so that was really great, a really good opportunity to sort of meet the AMS team from the UK and all of us to meet people in Uganda who, some of the partnerships, as you've seen, have been long-standing, and this one with critical care is slightly newer. So it's been fantastic. I've had such a good year as a fellow, and I'm going to carry on hopefully doing what I've been doing now my funded time has ended, because it has just opened up so many doors for me. And as you mentioned, I'm going to start a PhD in global health, so it's all really enabled me to put all that experience together to make this part of my ongoing career.
Right, so that sounds really, really exciting for you. I mean, where's the kind of impetus come from in terms of, do people come to the Global Health Partnership saying that we need help in this, or do you go with, look, we can offer that? How does it work? What's the dynamics there usually?
I don't know if you want to answer that one, Evelyn.
Yes, shall I start with that? So, I mean, they've developed, some of them have developed organically, some of them developed from a relationship between a clinician at CUH who, for example, at a conference might meet a clinician from elsewhere. And then they will start having discussions and things will grow from there. And so what we really apply are the principles of partnership, which are 9 principles that have been developed across health partnerships in the UK that really inform the way that we work. And foremost of those principles is the importance that what the partnership focuses on are the priorities and plans of our host country, so our partners. So, you know, that it doesn't work for a team from Cambridge to go in and say, what we think you need is this. So we are very careful to listen to our partners and to understand with them, but also to be mindful of what we can offer and where is our expertise, and then deploying that expertise appropriately. And also thinking very carefully about then what do we think that we can learn from our partners. So I was really struck last week talking to a critical care nurse who joined the team, the Scale critical care team, and she said what she was so struck by amongst the Ugandan nurses that she met in critical care was the resilience of those nurses. And she said she felt that the workforce, some of the workforce at CUH isn't as resilient. And she was saying there are things that we need to learn from those nurses and from that system that we can then develop at CUH to enable us to respond to crises in a better way. And so, yes, a range of ways that they develop, but then we also, and in terms of opportunities, we're careful to try and offer opportunities for people to be involved in a very open way, so that everybody has a chance to apply for specific roles, but also any member of staff who is interested can get in touch with us, and then we will try and match them with opportunities or match them with other organizations that might offer opportunities. And then crucially, just establishing that network so people can talk to each other and learn from each other about their different experiences.
Yeah. I mean, I certainly think resilience has been never more important to the healthcare sector than in the last 3 years. So anything that we can learn about that, I think, would be very, very valuable. So Laura, is there anything that you specifically would do differently in your day-to-day NHS work now as a result of being involved in the partnership? Is there anything that you do differently, or?
I definitely think I see healthcare with a different lens. I think that understanding that although the challenges across the globe are very different, one of the things that struck me in Uganda is actually a lot of the problems are the same. So a lot of the things, the staffing issues we have, gender issues that we have, they are the same, and so actually I think it's given me the confidence to address things in your own hospital that you see as a problem by actually thinking about global health as both going out, but also it's our day-to-day life. We have an international workforce, we have people with incredible skills who sometimes potentially get overlooked, and it's actually about taking all those things that you think about and applying them in your daily work. And one of the things I've been doing is working with international medical graduates coming to the UK and trying to provide a platform of support for them, because actually that's just as important as everything we're doing with our partners abroad. It's supporting those doctors and nurses that come to the UK and do a fantastic job for us, but possibly could be better supported when they first get here.
Yeah. And how's the pandemic affected that in terms of those people coming? Has that been difficult?
I think in some ways the pandemic has led to definitely the Zoom and the sort of networking that happens over the internet has improved some of the support networks we can have. So as part of our Ugandan partnership, we have 2 doctors who've been appointed to come to the UK as part of a training program. And so for the last few months, me and one of the other health fellows have got to know them. We WhatsApp, we have Zoom calls to support them getting through the various admin things that they have to do, some just life things, you know, where do you find accommodation? And that's been actually a benefit of the pandemic, is that we use technology in a way we didn't. And we've done, so something I've done as part of my Global Health Fellowship is doing simulation from the UK in Somalia. And that was amazing. And that just wouldn't have happened pre-pandemic, because we'd have just thought, well, that'll be rubbish and it won't work. And actually we've learned skills that now with our Uganda partnership, we're trying to set up reciprocal SIM between the UK and Uganda. And I think that's just exciting to try and make the best of what was a bad situation.
Yeah, make it work with what you've got. Yeah. Chris, I'd like to just come back to you. Is there anything that you've done in your work with the international partners you've worked with that's particularly inspired you? What's inspired you about that?
I think recognizing that you actually have more skills and knowledge than you actually you realize, and it's just inspiring me to talk to people about it, encourage other people to almost think outside the box. I think sometimes you get a little bit focused on what you're doing, your role, and you don't think broader. And sometimes we have challenges on a day-to-day that, as Laura was saying, they have similar challenges to us, our staffing and actually having equipment ready and all those sorts of things, and just sort of thinking, right, okay, what can we do about this? Can we take, is there something that we could find a solution that would solve this for us? And I found that really, really helpful. And it certainly has inspired members within our team to also think along those lines. And I think that's such a nice thing to do.
Do people want to follow in your footsteps of colleagues that you work with?
Yes. Yeah, I've got a couple lined up.
Well done. You're a trailblazer. So Evelyn, let's just come back to you then. Why do you think it's important that that CUH staff and students can and should maybe get involved in global health partnership activity? What do you think?
I think there's a multitude of reasons. I think first of all, which was recognised in 2007, is that a lot of people are doing this anyway, and it needs the recognition, but actually it needs the structure and support such that they do it in the best way they can, but also that they're thinking about how they're doing it, and then what they're bringing back from it. So those questions that you were just asking of Laura and Chris, what are you doing differently? And I think if you're thinking about some of that before you get involved and whilst you're getting involved, then you're more live to some of that. I think, again, as Laura and Chris have mentioned, we work with a very international workforce. Every day there's things that are coming from elsewhere, whether they're diseases or new innovations. And the better we are able to work in those multicultural teams, the more culturally competent we are and the more open we are to that learning, then the quicker I think we can adopt that. And also I think then the challenge of, what do we do well and how then are we sharing that with others? And I think if you distill that and offer it in an effective way, then you can do that if you're doing it with partners in Uganda, or indeed if you're doing it with the neighboring department or ward. And I think there is, I think there's also, in a sense, a moral duty. I think we have over 100 different nationalities of staff that work in CUH. We have Kenyan nurses, we have Filipino nurses, we have Indian nurses, and we know that a lot of those countries have healthcare systems that actually probably really need those healthcare staff, probably more than we do in the NHS. And so whilst we can employ those individuals, and it's fantastic giving individuals opportunities to develop, I think we also need to think about, how are we then involving them and supporting them and having partnerships that enable that reciprocal exchange to continue, and to recognize that as an institution, CUH can both learn, but also can give back. I mean, I think it's beyond giving back, because it is about an equitable partnership. And I know that that's the kind of moral obligation is something that quite a lot of our volunteers and members will come with, feeling that they want to do something.
Yeah. So the wider benefits to society, and
Absolutely. And as you started with, I mean, there have been multitudes of diseases before that have crossed borders, but the COVID pandemic, everybody was affected by it. And as Laura said, global health is all around us. It is not something that happens somewhere else.
Yes. Yeah. So just looking a bit further ahead, what about the future? So you have lots and lots to build on, clearly. What future partnerships would you like to see, Evelyn? What do you think's ahead of you?
So I think, a few things. I think it's fantastic all that we've done in Cambridge, and we kind of are recognised nationally for what we're doing. So we need to continue, in a sense, to lead some of that, and lead by example, as well as to learn from others who are doing global health activity. One of the things that we've started already is that how we are more active about involving diaspora members of staff in our health partnerships, and particularly at the kind of leadership level of our health partnerships. So there's a report that's been recently published called Experts in Our Midst. So actually CUH is joining as one of 6 NHS hospitals, a network that's going to trial some initiatives to give those staff members that opportunity to join our teams. And then I think we need to think about some of the core areas where we know in Cambridge we have particular skills. So thinking about things like cancer. Antimicrobial stewardship is a huge area that we have some on the research side, but also on the clinical side, brain repair, and then maternal and child health. So I think some of those big areas are places where we think we have expertise and skills to offer, but equally we think there's places that we also can learn from and learn in those areas to improve what we do, in what we deliver in Cambridge to patients in Cambridge and the region and nationally.
Yes. Yeah. So you talked even on one of your slides about win-win partnerships, and I was particularly interested in that, because in that you talked about staff retention benefits and less sick leave. So which is amazing, really. I'd maybe like to sort of put that question to Chris, because Chris, you're a nurse, and we're always talking about retaining our good nurses here at CUH. Maybe would you pick that one up? Why do you think that is, that it helps us to retain people? What's your view on that?
I think there's more than one thing here. So I think it's puts life into perspective, in terms of just sort of taking that step back, thinking about what's going on globally, and realizing that everyone's under pressure, and therefore I think if you have a happy team, if you've got a team together and they are reasonably happy, then they will be there and they will support one another, and it makes for an easier working life. But also, I think the fact that you have the opportunity to do this, what Evelyn may have forgotten about is that I'm currently doing my master's in infection control, and I'm linking in across obviously most of England, and we've got people coming from Cornwall, sorts of places, and I've talked about the fact that I've been to Uganda and how I found that beneficial, and so many of them are really keen. They want to be involved in something like this, and I think we're so lucky to have that opportunity to be involved and to sort of be recognised that that your value as a nurse is wanted, because I think sometimes we don't always feel valued, and that won't just be me as a nurse. I think that's anybody in the NHS, where we're all having a tough time, and we see that COVID is spiking up again rather than dropping down. All those sorts of things put pressure on us. So I think the fact that you can see that your trust, your organisation appreciates you and wants you to be involved in something like that and is prepared to support you and do that, I think that's just wonderful.
Thank you. Yeah, I can see that. So I'd just like to now turn to some of the questions we're getting from our audience here, the one I guess let's go to the thought of funding about to support the trips for CUH staff. What do you where does that come from, and how do you raise your funds for that? Can you maybe look at that one for us, Evelyn?
Yeah, so funding from a variety of sources. We were fortunate for some of our partnerships and had some UK aid funding, and then that was completely cancelled at the beginning of 2021. So there was a £40 million health partnership scheme that had been launched that we'd applied to, that was then completely cancelled when they reduced the commitment to 0.7%, which was devastating for us. Fortunately, we have a fundraiser within our team, and that's Hannah. And so we have worked hard to identify generous individuals and trusts and foundations and some corporates that have supported our work. In terms of funding the visits, we support individuals, our members, our volunteers, and cover the majority of their costs. Like I said, they will take a variety of leave types. So some of them will be able to take some voluntary release days from the hospital and professional study leave, but they will always match that with some days of annual leave. And we don't charge, obviously, for their expertise. So that's the kind of the biggest thing that we facilitate. And likewise for the exchange visits coming this way. So in any application, we will put in funding for visits both ways. Sometimes we've had examples. So for example, we had a group of nurses who came over from Botswana in 2017, and the Botswana government funded the nurses to get to Cambridge. And then we found funds in Cambridge to host them whilst they were here. So a variety of sources, but we're looking hard and trying to find ways that we can diversify our income sources.
Sure, yeah, that must be a challenge. So we've got a question here about partnerships more broadly across the NHS, and the question really is about: is there a central list of trusts that are involved, And do you collaborate and coordinate with each other? Does that happen?
We do actually. You know, one of the things that I enjoy most about my work is that it is so collaborative within our individual partnerships with our international partners, but collaborative with other partnerships across the UK. So it's a really kind community. And there's an organisation called the Tropical Health and Education Trust, who are based in London, who for 30 years have supported health partnerships. And actually, it was the founder of that organisation that Mary Archer heard speaking about health partnerships that then prompted her to start initiating something at CUH. And so THET convene a conference, they convene health partnerships to come together. They have a really good platform that health partnership members can join that enables all that collaboration. And we work together. We also work together very closely, particularly with King's Global Health Partnerships in London, and have shared learning days. And where we have, so for example, in Sierra Leone, we both have a project supporting stroke services. So we're working closely together to make sure that we're working together with the government, so that one day they don't see King's and the next day they see Cambridge, but also that you know, we're making sure that what we're doing in one part of Sierra Leone then fits with what King's are doing with their partners in another part of Sierra Leone.
Yeah, good. So
I'm sorry. So in terms of the response, the question about the list, so THET sort of hold that list. So if you particularly wanted that list, then I would definitely say to contact THET. They used to publish it on their website. I'm not sure that they do anymore, but they certainly have the kind of best knowledge of all their health partnership activity across the country.
Evelyn, what's that? Can you just tell
so yes, THET is the Tropical Health and Education Trust.
Thank you. Yeah, thanks.
Yeah.
So we just got another question about systems-based models, which I don't really understand. So I'm hoping somebody can help with this one. So what have we learned from the Global Health Partnerships work that could support the move to system-based models that we're adopting? Who would like to pick that question up?
I think that's Laura's.
Yeah, I'm not entirely sure. Systems-based modelling in terms of within the hospital. So certainly we are looking at healthcare systems in general, and actually that's part of what I'm going to be learning about in my PhD. And I think we can learn an awful lot from global health partners, because systems only work if they're contextualized to the environment you're in. So and something we've definitely learned from even just from our visit in Kampala a few weeks ago is what works in Cambridge may not work somewhere else. The principles might be the same, or but actually when you're looking at systems, they have to be contextualized, and the only way to actually get that information is to build partnerships. So a lot of the work is understanding what the healthcare systems are, what their needs are, but also what the structure is, the infrastructure. So there's a lot of work going on trying to just understand the healthcare system in order to then be able to best work out how best to develop that system. So I don't know if that's what you meant, but hopefully that answers the question.
Yeah, thank you. Anyone else want to come in on that one?
Can I just say something? And I think for us, when we went out in 2019, we actually had 2 behavioural change students with us, and Claire and Taya, and it was really beneficial to see them, you know, take on board, as Laura was saying, the key learning points, looking at their systems and trying to make it easier for us to go back in September and look at the teaching that we should and could provide for them, and what would potentially work well and what wouldn't work well. Learned so much from them, and certainly that is something model-wise I'm looking at in my master's currently, and looking at what suits one person might not suit another. So I think it does spread across the board, definitely.
Yeah.
And I think I'm right in saying, Chris, that actually the pharmacy team that were part of that partnership, they then, and I don't know if they did get the approval, but they certainly put a business case forward in CUH to have a behavioural change scientist join their team, having seen how effective it was in Uganda, that they then wanted to use behaviour change methodology and expertise much more actively within their work within CUH.
yes, they did, and I think they did get it. So yes.
Good, good. I just have a question here. I think it was Laura, you talked about multidisciplinary teams working together. Clearly, what challenges do you get from that kind of scenario, working outside of your sort of home environment?
I think there are definitely cultural challenges that we have to be sensitive about. So when we went to Kampala, we went as a team, and we had our lead nurse for the project. And one of the things that struck us when we got there was that there were not many nurses invited to some of the meetings, and it was something that we rapidly identified and made sure that actually we had nursing representatives, because particularly for our critical care project, nothing will happen if we don't have nurses. It is the sort of foundation of making the project work. And I think it's just understanding that sort of cultural differences. We're very used to working very closely at all levels with our nurses, and absolutely the nurses are just as critical there, but it's just understanding the sort of the dimensions and making sure that the right people are involved in discussions. But on the flip side of that, I think working in the MDT, certainly my trip to Kampala, I met some of the most inspirational nurses I have ever come across, that are so just doing fantastic things with relatively minimal resources, so keen to just get involved. And so for me, you know, I met this brilliant simulation nurse in a town that was 5 hours drive from Kampala, and what she was doing there was just incredible. And so it really hit home that this isn't just about one group, doctors, nurses, it's physios, it's everything, and it's all of us working together, both as a team from the UK, but as a team with all of us together. And I think all of these partnerships, it's the crux of it. It just doesn't work if you look at it from one staff group. It's got to be everybody, like we work in the UK, but actually, again, we're not always brilliant in the UK at working as an MDT, and we can learn a lot from these partnerships.
Mm-hmm. Yes, thank you. Thanks, Laura. So I'm just looking at the time here. Namu, have we picked up all the questions from Facebook users?
We've not received anything from the staff Facebook group, but I can see we've got one in the Q&A box. I think if we just pick that one and then we can close.
So
thank you.
One for you, Chris. What were the main pointers for resilience that you witnessed amongst the nurses? Yeah, resilience is back again.
That's a good. They work really well as a team. They are very bonded in that, and they all have, you know, they all focus on the right goal, which is, you know, about the patient and caring for them. And I think that's very key, because if you don't work as a team, you know, then things will leak through and things won't happen. So it's, you know, it almost harks back to sort of old-fashioned sisters and matrons, but, you know, that structure does work very well for them, and they respect it, they appreciate it, and you know, they take on each other's point of view and work through what their problems they might have in the day.
Yeah, learn a lot from that, I can imagine. Thank you. So conscious of time here, I think Evelyn, you've mentioned, I think it's anyone who wants to get involved. There was a slide you put up, which we're actually going to be sharing this recording of the webinar in the CUH bulletin, and also in the August membership newsletter for anyone who is interested in that. And presumably you're open to if anyone gets in touch with you generally about that. So I'd like to just bring the session to a close now, and just to say a thank you to our speakers. That's been an absolutely amazing learning experience for us to just find out about your work. It's fascinating. Good, keep going, keep doing it, because it's really is a good thing. and to just say thank you to everyone for joining us this evening as well. I know it's been a warm evening, but I hope you've all enjoyed the discussion. Thank you all for your questions. Thanks everyone.
Thank you.
Goodbye.
Thank you. Bye.